was one patient whose mom brought him in because he had been having seizures at home all day. Not the full-blown tonic-clonic, foaming at the mouth kind of seizures, but he had these complex partial seizures where he would sort of shake in one arm or lose awareness for a little bit and then go into like the shirt grabbing phenomenon, and then sort of come out of it, but then he would go back into it again. So he wasn't recovering, and instead of taking him to the hospital, they brought him to the clinic. So we're seeing him in clinic and trying to take care of him. And he's a known epileptic, by the way, so this isn't like brand new, so the mom's not freaking out. And he's recovering from his last seizure when I walk into the room. And he's there, but he's not there. Like, you can have him respond to you and maybe tell you his name, but he's otherwise just kind of staring off and something's off. And then in the middle of that, he starts kind of grabbing his shirt, and he's not responding to anybody. He's not saying anything. And as soon as he stops grabbing his shirt, he gets up off the examination table and starts walking around the clinic. And he walks out into the hallway. Next thing I know, he's walking into another patient's room, and he walks out of that room, and there's nothing you can sort of do to stop him. Like, I don't know if you really want to grab his hand because you're not really sure how he's going to respond. Is he going to be physical? He was a bigger guy too, so it's not like he's easily subdued. Like, it would take like 3 guys to subdue this guy. So I sort of put my body in front of his body to stop him from getting through, and he just sort of walked around me and kept going. And eventually his mom was able to convince him to get back in the room. And that was sort of it. And I think we sent him to the hospital afterwards just so that they can keep a closer eye on him. But it was an interesting case, and that was what we called complex partial seizures.